Hello, everyone. Thank you for joining us. We really appreciate you taking time out of your day to learn about this procedure. Dr. Smith and I are both very excited about the new opportunity that it offers to get really good long-term pain relief. And just a little bit about myself. As probably many of you know, I practice in Chandler. I've been here in the Valley for about 12 years and have noticed, even since the beginning of my practice, that SI joint pain is a very significant part of the pain burden that many of my patients deal with. Often there are other things that may be done for other areas of pain that can ironically increase SI joint pain. We're going to talk about a few of those things. This is an interesting slide about, some of the different things you might feel. You might, try to stand up after you're sitting down and feel severe pain in your back. You might be shifting around as you're seated. Maybe you've tried some injections and the pain comes back fairly quickly. Maybe you tried the injections and you feel like the pain was in a different place than those injections went. You move and it really hurts. There's just a lot of different ways that you can experience low back pain. The low back is a challenge for doctors to treat because there's a lot of overlap with different pain conditions. And so you may have arthritis of the spine, or you may have a pinched nerve. You may have SI joint dysfunction. You may have some sort of muscle strain. You can have, and there's a few other conditions, all of which cover the low back, extend into the legs, extend into the groin. All these can present a little bit differently, but they all have a significant amount of overlap. And so you may have tried some therapies such as physical therapy and chiropractic care. Those are great places to start if you have low back pain. Often those can take mild or moderate back pain and really improve them. Even if they don't completely take the pain away, they can be very helpful for setting up for success for other more advanced pain therapies. Injections of the sacroiliac joint and epidural injections for pinched nerves are very common. Sometimes we treat arthritis with radiofrequency ablation, which is a good long-term therapy. If these things don't work, often people are moving on to spinal fusion or laminectomies. They might move on to spinal cord stimulation. And then, of course, all throughout this, people might be on opioids at increasing doses with side effects and other problems that come with those medications. And even with all of these therapies, you may still have significant back pain. So specifically with sacroiliac joint dysfunction, this is a problem typically caused by too much movement in the SI joint. The sacroiliac joint is a true joint just like your knee. However, unlike your knee, which is very smooth and moves easily and freely, the SI joint is not really designed to move very much. It might move by a few millimeters or so, and it's really tightly bound by ligaments to try to support it. So this joint, unlike the knee joint, has waves and ridges, and so that if the SI joint moves too much, you now have, instead of waves and ridges that are nestled close together in the proper way, are now set so that the edges are on top of each other and there's pressure, and that leads to irritation and leads to SI joint pain. Probably about 1 in 3 patients with chronic low back pain has some element of SI joint pain. It's often missed because when some physicians think of low back pain, they think of the spine, and they're not thinking so much of the pelvic ring, of which the SI joint is part. And sometimes other interventions seem to fail because, in fact, there was either some element of SI joint dysfunction or it was primarily SI joint dysfunction. And again, because there's a lot of overlap in low back pain between SI joint dysfunction, arthritis of the spine, pinched nerves, that sort of thing, it can be a little bit difficult to really peel apart those layers. The SI joint can become painful when those ligaments are too loose or too tight. If you've had a car accident, an injury at work, a fall, those things can cause jarring of the joint. They can cause irritation and damage to the cartilage. In pregnancy and in childbirth, the ligaments actually loosen, and that's to allow the baby to pass through the pelvic canal, and that can cause a lot of low back pain, and of which SI joint dysfunction is one, because now the joint is out of alignment. And with surgeries such as hip surgery, or even more commonly, a lumbar fusion, and especially when the lumbar fusion includes an attachment to the sacrum, that causes a lot of pressure to be transmitted to the SI joints that are not really meant to handle that kind of pressure. And again, causes irritation, inflammation, causes the joint to become out of alignment and be very painful. So these ligaments and muscles that support the SI joints are there normally to accommodate some movement, but when there's a lot of movement, when the cartilage wears out, they can't really hold that joint together as well, and that causes that pain. Some of the symptoms that you would see would be pain in the low back that goes into the buttock, sometimes extending to the groin, sometimes extending into the thigh, typically worse with standing. So if you're at the sink doing dishes, for instance, you may notice that it's just very hard to stay there for more than a few minutes. Could be painful with walking because those joints are moving abnormally. But even just laying still, sleeping, could put some pressure on those joints. So it's really important that you come to a good diagnosis of exactly what's causing the low back pain. And sometimes it can be a little frustrating because there is more than one issue. You could have a pinched nerve and some arthritis of the spine and SI joint pain. So it could be that you have to treat all of these different things to eventually arrive at the diagnosis of SI joint pain. So Dr. Smith is going to talk to us a little bit about how this procedure is performed.
Okay, well, thank you, Dr. Pico. And for those of you out there that don't know me, I'm Dr. Smith. I'm the Goodyear pain doctor here at Arizona Pain Doctors. I've been out on the west side for about 6 or 7 years now. So thank you guys for showing up today. I'm going to talk a little bit about the actual procedure, the LinQ procedure today. But before I do, I just wanted to second a couple of things that Dr. Pico mentioned. In particular, the fact that, SI joint pain is very prevalent. Dr. Pico mentioned, 1 in 3 patients can have a degree of SI joint pain. And I think that's important to realize, because I think some people think that SI joint pain is kind of a secondary thing and it doesn't happen without other things, but we see it very frequently. And another thing to kind of recognize is it can be very debilitating. Another thing I think some people think is it's not necessarily a severe pain, can't cause severe, decrease in your quality of life. And, we see patients that really have debilitating pain from their SI joint that really affects their quality of life. It's important to realize that this is it's an important pain to diagnose and recognize. And the most exciting thing I think about this procedure is that it's a new avenue for minimally invasively treating the SI joint with fusion, which can effectively provide more long-term relief. Historically, we've had things like SI joint injections, which are usually steroid-based and or local anesthetic-based, and they're important for diagnosing that patient might have SI joint pain, but they usually don't provide a significant long-term relief. And then things like radiofrequency, a lot of patients can get more long-term improvement, but that's usually months. In this procedure, we're talking about potentially years of relief, maybe even a lifetime potentially. So I think that's important to realize. One of the big things about this procedure, as opposed to other procedures that you might do for fusing the SI joint, is it's much more minimally invasive. I've taken care of patients who have had some of the other procedures, fusion procedures for the SI joint. It's I hate to use this word, but it's a much more barbaric procedure. Those procedures usually involve, using fairly large pins and drills to drill through the ilium bone into the SI joints. And so it's a much more invasive procedure. So it's very important to understand that this is a much less invasive procedure, and the outcomes have been just staggering. I think this works as well, if not better, than those bigger procedures. So from the patient standpoint, it's great that it's minimally invasive. It's an outpatient procedure usually done in a surgical center. We're not drilling into bone, and because it's a smaller procedure, the recovery time is usually much faster, as opposed to, I've seen patients with the other procedures have to be in a wheelchair due to pain and just not being able to bear weight for, a week or so. And in this case, you can be on your feet pretty much the next day. Has a very low infection or complication rates. And so those are all, very important things to realize. So let's talk a little bit about what exactly is this device, or what it's made of. And so you can see there's representation of the actual device on the right there. And so Dr. Pico mentioned that this is a device that provides what's called distraction. So what we do is, well, let me talk about first. It's actually made out of actual bone. So we call it cortical bone, which is the hard part of bone. So this is a device that itself is made out of bone. And then as we're inserting it as well, we also put a material called DBM, which stands for demineralized bone matrix, which is basically kind of like a soft bone matrix. And we fill the center of this device and around it with that, so that once we insert it, the fusion of the joint actually happens. Before that happens, this device also distracts the joint. So the idea is by distraction, it removes that micro movement at the SI joint. And that's why a lot of patients experience pretty immediate relief of their SI joint pain. They may have some post-operative discomfort right away, which is very normal. But a lot of times they'll have almost immediate improvement in their SI joint pain, which is great. So that's kind of what this is made out of.
PainTEQ's LinQ is an innovative way to solve patients' SI joint pain using SI stabilization with a minimally invasive medical procedure. Patients get long-term benefits and faster recovery than other SI fusion methods. The process is broken down into 4 steps. First, the Steinmann pin is inserted into the SI joint between the sacrum and the ilium. There is no drilling involved. Next, the tissue dilator and working cannula are inserted, creating separation in the joint. Then, the broach rasp is inserted to create room for the LinQ allograft to fit comfortably and at the same time initiate decortication. The broach and rasp are removed with a simple unscrew, reverse hammer, and pull motion. Finally, a large graft window of the LinQ allograft is filled with DBM and placed into the SI joint. The inserter ensures that the LinQ is positioned perfectly, allowing SI fusion to begin. This step helps create the perfect growth environment for LinQ to work. LinQ enables you to fix the pain, not mask it, allowing your patients the ability to take back their life again.
Okay, well, hopefully that video, I think it does a pretty good job of obviously explaining. I think I'm always amazed that video shows it looks like a pretty straightforward procedure, and in reality, because of the minimally invasive nature behind it, it is a pretty quick procedure. It only takes about usually about 15 to 20 minutes max. And so it's just amazing that we now have a device that can basically work to fuse the SI joint long-term in about 15 to 20 minutes. It's just kind of remarkable. So, and so let's say you were to have the procedure, what kind of to expect after you had the procedure. So some of the most common things that people have concerns about is the actual incision site itself. This is only about a 1-inch incision, so it's not a big incision. It's usually kind of in the mid to upper buttock area, depending on your anatomy. I'm not going to speak for Dr. Pico, but I assume he does them very similar as far as how he closes up his incision. So usually just a series of sutures that are dissolvable, and then on the skin, I usually use some glue to keep the skin together. Everything dissolves, so we don't take stitches out. You wear a bandage. I usually have you wear a bandage and follow up in 3 days, and I remove the bandage myself. And then after that, you're free to shower and just some basic sort of wound care. It's nothing crazy. We do restrict your activity levels for about 6 weeks, especially when that comes to more heavy lifting, maybe repetitive bending, things like playing golf or running. We would definitely restrict for about 6 weeks. But almost right away, you can pretty much be on your feet and you can walk and do, pretty normal activities almost immediately. I usually have my patients try and baby the joint or the leg that we did the procedure on for about a week. I don't put them in a wheelchair or anything. A couple of them have kind of used maybe a cane to kind of take some weight off, but I don't think that's absolutely necessary. It's just something that I've kind of adopted. So, and then, it's always as you heal and as you feel better, it's increased activity as tolerated. All right, so this is I have a couple of testimonials. We're going to play one of these testimonials.
My SI joint pain in the beginning, when I first came to Dr. Azim, was extremely severe, and it was the point where I was basically immobile. It was an effort just to get out of the chair, to walk to the bedroom, to go to the restroom. You know, my hobby and passion is fishing, and to lose that was very frightening. You know, at first, of course, you have some reservations, but the way Dr. Azim explained it to me and how the procedure would work and how simple it was really a no-brainer. It is a relatively non-invasive surgery. It's just a small incision, and then when you come out, everybody's so pleasant and nice. Well, if I had known sooner about the procedure, we'd have done it 2 years earlier. We went just as soon as we could get approval, and he'd done the diagnostic injections prior to it. It's an amazingly simple solution. There's no after feeling or that there's anything there. I just feel normal. And my pain was reduced by 85 or 90%. Fortunately, after having the surgery, I've been able to go out in the boat. We've been out several times.
Okay, yeah. So again, you know, that kind of drives home the point I was making in the beginning, that this SI joint pain can be debilitating in a lot of patients. As far as kind of my experience, I've been doing this procedure for about 6 months to a year. In my experience, patients are consistently getting upwards of 80 to 90% improvement. And again, that's pretty immediate improvement. And on follow-up, that's lasting improvement is what we're seeing as well. So it's pretty remarkable improvement for a 15 to 20-minute procedure, and it's really something that we haven't had before, and that's what makes it so exciting. I just think it's an exciting time for this procedure. All right, I'm going to go through a couple probably the most frequent questions we get asked in general about this procedure. So does it require an overnight stay? No, it does not. As I kind of stated, it's an outpatient procedure at a surgical center. Takes 15 to 20 minutes and a little recovery time, and you're back at home on your own. Is it covered by Medicare? Yes, it's covered on Medicare and most insurances in general. So that's another good thing, is it's definitely covered on insurances. And if you've had a prior fusion or laminectomy, are you still a candidate? Yeah, I would say definitely you are. And in some cases, I think Dr. Pico mentioned this, is if you do have a previous fusion, especially the low spine, we oftentimes see that SI joint pain is very common, okay? And so a lot of patients we see that have had previous fusions have quite a bit of SI joint pain. So a lot of patients are very good candidates. What about other procedures, spinal cord stimulation, RFA, or injections? Yeah, this doesn't really prohibit you from having any other procedure or undergoing any other imaging or anything like that. Another great thing about it. Can you still have MRIs, CT scans? Absolutely. There's no contraindication with this device to anything like that. Will I get immediate pain relief? And like I said, in most cases that I see, patients are getting immediate pain relief. And again, I think that's from this device goes in and distracts that joint immediately, so that micro movement is stopped. And that's where a lot of patients, I think, feel their improvement. What if I have pain on both sides? Well, believe it or not, I saw a patient today that just got done with his both sides. He did the left first and the right. So you can definitely have this on both sides. Usually we do, for obvious reasons, we kind of do one at a time so that you can heal on one side. We don't do, or at least I personally don't do them both at the same time, but you can have both sides done if we're pretty sure that both sides you're suffering from SI joint pain. So, okay, that's pretty much all we got. Hope you guys enjoyed that, and it was, you learned some things, and it was educational. I guess we'll hand it over now to questions.
We had a few questions, Dr. Smith, in regards to insurances, but you more or less kind of touched base on that. Obviously, with your authorization department and everything, you guys have been able to get most insurances approved.
This is a tough question. This is probably the most common we get because everybody's obviously concerned with it. Getting into specifics, we have had very little issue, I think, with with Medicare. We do have our own authorization team that is great at doing anything and everything that we can. Usually as part of the authorization, we may need some different imaging. We have to prove that it is SI joint pain. What I mean by that is you need to have diagnostic blocks that say that you got 75%, diagnostic injections, I should say, that you got 75% relief or more for at least, several hours to a day or so. So there is some things we definitely have to take care of before we can even submit for this, but we're having very good success with pretty much any insurance. I can never promise anything, but if you really have questions about that, I would say come in, and the only way we can really truly determine is first make sure that you're a candidate for it, and then kind of put it through the authorization process and see what happens.
Another question we have here. I have 2 rounds of injections, acupuncture, PT. What else do I have to try before I can do the procedure?
It really depends on insurance requirements. And it's one thing I wanted to add on to what Dr. Smith was saying is that each insurance company, while this is a covered procedure on almost all insurances, each insurance company will have some different criteria. For instance, some will require certain imaging studies that others don't, but all of them require certain physical exam findings and then some SI joint injections to prove that the pain is actually located in the SI joint, but that more conservative therapies can't control that pain for the long term. So it doesn't sound as if SI joint injections have been done. And that may be the case, I'm just not sure. And we'd also need to have appropriate physical exam findings that would show significant pain in the SI joint.
We have another one here, and Dr. Smith, you did touch base on this, but it says, what is the difference between LinQ and iFuse? Can you just reiterate the major difference between those two?
The biggest difference is how invasive the 2 different procedures are. So you guys saw a kind of animation about how there's a small pin that goes into the SI joint, and then the device is basically, after just some minimal reaming at the joint line, that's where the device is placed. Without getting too technical, I can tell you that the other procedures like SI bone, these are they're pretty big pins. I'm going to try and usually 3 of them that are basically inserted more surgically from the side after they drill out bone. And they are usually inserted from the ilium, so the hip bone, into the SI joint, which is not only much more invasive with a longer post-op course, it's also potentially more dangerous because of the way you're doing that. There's potential for, I think much more potential for side effects, bleeding, infection, and definitely a much longer recovery time. If it was something where we were seeing massive differences in results, but like I said, we're seeing great results with this more minimally invasive procedure. And I think even the reps that have done both are telling me that they think that they're actually seeing better results from this procedure than the SI bone. I think part of that might be the minimally invasive nature, because when you're doing a procedure that invasive, you can have chronic long-term pain from the procedure itself. So I think that's one thing to keep in mind. So
yeah, I'd also like to add that the reason why Dr. Smith and I are using the LinQ procedure as opposed to the 4 or 5 other companies that are out there, it's not because any of these other companies provide a bad product. They're all good products. The folks at PainTEQ have really invested a lot into some significant studies, and it makes us both feel quite a bit more confident knowing that they have really solid data to back up their device. Too often in pain management, there are just small studies that aren't quite as powerful as the studies that this company has done. And so you can undergo this device knowing that not only has Dr. Smith and myself had really great results, but there's data back up this device.
Well, thank you, Dr. Pico, and thank you, Dr. Smith. I wish we could answer everyone's questions, but we are running out of time. So I would make an appointment with the number there, or azpaintdoctors.com. And if you could we're going to have a poll there at the end of this. If you could fill that out, we would really appreciate that.
One thing I'll mention really quick, Ed, before we go, I did see a question on here that mentioned Dr. Frankie, which is another doctor in our practice, great doctor. If there's a physician at a location that's maybe not performing these at the moment, I think I speak for Dr. Pico as well. As a practice, we can have these done if you talk to Dr. Frankie about it, and it's something that he thinks is a good way to sort of proceed. One of us would be happy to make it happen. So just wanted to add that really quick. I don't want people that maybe at another location to think that this isn't something for them.
Ed was saying we're going to have a Q&A or a poll here that you see on your screen. It's basically just saying if you'd like to be contacted and when you'd like to be contacted. And then Dr. Smith and myself are holding open slots on our schedule so that if you didn't get your question answered, and there were a lot of really great questions that we just couldn't address, we would like to address those with you individually, because sometimes there may be something that we need to do beforehand in order to move to this procedure, or there may just be something else, but we want to make sure that you're getting exactly the right procedure and exactly the right time. So we're going to hold up in some slots so that we can have that discussion with you one-on-one. And the folks at PainTEQ will be able to help coordinate some of that to get you in to talk to us.
Well, thanks again, guys. And thank you everyone for joining. We really appreciate it.